This is my audience. Hi guys, it's Brianna again. Today I would like to take a few minutes of your time to discuss a topic that used to bombard our TVs but has been maligned by COVID and the pandemic, and that's sexually transmitted diseases. I want to begin by defining what a sexually transmitted disease is. And per the Human and Health Services Office of Women's Health, a sexually transmitted infection is an infection passed from an infected person to an uninfected person through sexual contact. Types of sexually transmitted infections are chlamydia, HIV and AIDS, gonorrhea, syphilis, HPV, and herpes, per the CDC. The causes for these infections/diseases are microbes. A microbe is a microorganism that is not visible to the naked eye, such as bacteria, protozoa, and fungi, all three of which we'll be talking about today. And that definition was obtained from Merriam-Webster. How do microbes cause sexually transmitted diseases? Via sexual intercourse, whether it's anal, oral, vaginally, and skin to skin contact, hence kissing. How are infected persons affected? Infected persons experience an array of symptoms that range from itchiness to discharge, pain while urinating and sexual intercourse, sore throats, and blisters. Risk factors for these infections are having multiple sexual partners and having unprotected sex. The diagnostic procedures for this to diagnose sexually transmitted diseases are having a physician do a physical exam, sometimes a culture from penile and vaginal secretions, and in cases of HIV and AIDS, it would be a blood test because that's the only way it can be picked up. The solution to our problem, which are these sexually transmitted diseases, would be a contraceptive. Traditionally, a contraceptive is a medicine or a device that prevents pregnancy, but in this case, we're not discussing pregnancy, we're only talking about diseases. And the only contraceptive that inhibits the transmission of these diseases are condoms. Only one. And also, along with condoms, abstinence if you are sexually active. Condoms prevent the spread of sexually transmitted diseases because it covers the penile shaft. And when ejaculation occurs, the semen is entered into the condom, and it's a barrier between that and the vaginal pathway. So it's no contact whatsoever. And here I have created this poster board to illustrate and emphasize the importance of practicing safe sexual intercourse to prevent the spread of these STDs. Here we have chlamydia. This is chlamydia of the cervix, this little white part here. And this is chlamydia that's on the penile head, which is here, and you also see the redness, the irritation here. And here we have gonorrhea, which mainly you see here is just discharge here and discharge here. Now here we have HPV, which is genital warts, hence this area here, which is on the skin itself. And then these warts are on the penile shaft. Here we have HIV and AIDS. And this is actually not a depiction of the actual disease. It's a skin cancer that people infected with HIV that turns into AIDS experience as the disease progresses. This is syphilis. This is primary syphilis, and this is secondary. Here we just have a blister. Here is blisters that are also scabbed over, which don't appear to be healing. And lastly, we have herpes. Herpes are these little areas right here, just skin blisters on the labias of the vagina. Now we're going to talk about and see our causes, which are these microbes. This happens to be the microbe for chlamydia. And this is the microbe for HIV. Then this is the microbe for AIDS. Notice the difference in the two. This microbe is for gonorrhea. And this is the microbe for syphilis, the microbe for HPV, and the microbe for herpes. Notice the difference in all. They're not the same size, shape, or anything. And over here we have our solutions. Our male contraceptive, which is a condom. Our female contraceptive, which is a female condom, not commonly used. And here we have an abstinence key that basically gives you the pros and cons of what it is to be abstinent, which means to refrain from sexual intercourse until married. That can help prevent all of these sexually transmitted diseases along with unwanted pregnancy. This concludes my speech. Thank you for your time.